interventional pain management modalities. Any discussion of pain management modalities should begin with an overview of what pain is. The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience relating to actual or potential tissue damage. Psychological experience could be added to this also. Pain can be divided into two broad types, nociceptive and neuropathic. Nociceptive is more acute in nature and is caused by injuries to tissues other than nerve tissues. Neuropathic is more long-term and chronic in nature and is caused by actual damage to nerve tissues, peripheral and central nervous system. Why does pain need to be managed? Poorly treated and managed acute pain can become chronic pain, and patients with poorly managed pain are at risk for depression, delirium, cardiovascular events. They also have slower healing times and typically longer hospital stays. Society pays a high price for the cost of pain. Pain affects more Americans than diabetes, heart disease, and cancer combined, and accounts for more than 20% of all medical visits and 10% of prescription drug sales. The most important element of determining a patient's pain is the pain assessment done by the nurse. This is usually done with an interview asking the patient to rate their pain on a 0 to 10 scale, 0 being no pain and 10 being the worst pain. The smiley faces can be used for patients who are unable to verbalize or articulate that scale. Interventional pain management modalities can be divided into two broad categories, pharmacological and non-pharmacological. Pharmacological involves drugs and medications. Non-pharmacological involves methods and modalities other than drugs. Pharmacological modalities can come in a wide variety of forms and delivery methods, including PO meds, which are oral medications, injectable medications, transdermal patches, where the drug goes through the skin, and IV, intravenous administration. Of the three main classes, the first is opioids. Opioids include morphine and synthetic opioids. Morphine is the gold standard, which by all other pain relief drugs are measured. Opioids also include synthetic opioids, such as fentanyl. Non-opioid analgesics do not contain any opioids, but they contain NSAIDs, such as acetaminophen. Acetaminophen is probably the best known non-opioid analgesic, and its most widely known trade name is Tylenol. Some pain medications are combinations of opioids and non-opioid NSAIDs. Two examples are Percocet and Vicodin. Both are combinations of synthetic opioids and acetaminophen. The third class of pharmacological modalities are the adjuvant drugs. Adjuvant drugs are drugs that were originally designed for another purpose. An example here shown is nortriptyline or Pamelor. It was originally designed as a psych med to treat depression and obsessive compulsive disorder, but has been shown to be successful in pain relief. Pharmacological modalities have different delivery systems. One is the patient-controlled analgesia, or PCA, where the patient controls the time of the dose. Another are nerve blocks by indwelling catheters, where a specific nerve is targeted. Here we see a sonography-guided femoral nerve block. The second broad group of modalities are the non-pharmacological modalities, which include heat and cold, acupuncture, therapeutic exercise and massage, and electrical nerve stimulation. Heat and cold therapy is probably the simplest and least expensive, and is done for sports injuries, minor aches, muscle aches, sprains. It can easily be done at home, but is also done in a clinical setting. Another non-pharmacological modality is acupuncture. Acupuncture has been around in China and the Far East for thousands of years, but has only been widely accepted here in the West in the last few decades. But it has been proven in studies to successfully relieve pain. One specific side adjunct measure of acupuncture is auriculotherapy, which uses various needle points on the ear. And as you can see in this chart, certain areas of the ear correspond with particular musculoskeletal points, and studies have shown this to be effective in relieving pain. When done in a therapeutic and a clinical setting by a trained healthcare professional, exercise and massage can be effective. Here we see a trained healthcare professional in a clinical setting doing range of motion and exercise on a man's neck area to relieve pain. Electrical stimulation of nerves. TENS therapy, transcutaneous electrical nerve stimulation, is widely done in the United States, mostly in sports medicine and for pain to muscles relating to training, sports training, weightlifting training. And what happens is the electrical current goes into the muscles. Cognitive and sensory therapy is effective. Cognitive would include yoga, meditation, relaxation, and distraction techniques. Sensory would include aromatherapy and auditory therapy, such as soft music and background noise. Studies have shown that a multimodal approach to pain management produces the best results and takes into account unique individual patient-specific factors such as gender, medical history, and the psychological and cultural aspects, as well as the economic considerations. Studies have also shown that it significantly decreases post-operative pain and its development into chronic pain.